Well, we're back right here on Hala Kuwait, and I hope everyone out there is enjoying their evening. We have with us right now Dr. Mohammad Alsulaimy, and Dr. Mohammad is a senior specialist, general laparoscopic and bariatric surgery on hernias. Doctor, welcome to our program.
Hello.
Nice to have you with us tonight.
Nice to have you, thank you.
Doctor, first off, tell us now, hernia. What is a hernia, please?
All right, so it's a very common surgical condition which we treat as surgeons. So a hernia is basically when something from the insides of your abdomen, so anything from your nipples, basically down to your thighs, from the inside, pushes through a defect or a weakness or a hole through the muscle which usually covers that area. So it's typically a piece of fat from the inside, or it could be a piece of intestine.
Okay, so what causes the hernia, doctor?
So there are many causes for hernias. First, you could be born with a hernia. You can notice that shortly after birth or several years after birth, or with aging, the hernia becomes more and more obvious. As the tissues become older and older, the hernia becomes more obvious, but you've been born with it. Secondly, it can be caused from previous surgery. So any surgery, from an incision from a surgery, can cause weakness in the area where the surgery was done, and that can cause a hernia. And then there are other causes, like people who smoke a lot. The smokers, they cough a lot. It causes a lot of pressure from the inside, and it causes the hernia to bulge. People with chronic constipation who strain a lot in the bathroom, they can get hernias as well. People who strain a lot during urination, we see that in men with large prostates. They can get hernias also. And obese patients can get hernias. Multiple pregnancies can cause also hernias as well.
Okay, so those are some of the causes. Are there different types of hernias, doctor, you'd shed some light on?
Yes, so we can go ahead, so the common hernias are the umbilical hernias, which happen at where, your belly button is.
Mm-hmm.
And then you have the groin hernias. They can be divided into inguinal and femoral hernias, depending where exactly they are. And then we said they are from the previous surgeries. We call them incisional hernias from previous surgery. And then there are some rarer hernias, like the diaphragmatic hernias. The diaphragm is a big muscle here which separates the chest from the abdomen, and you can have a hole in the diaphragm, and through that hole a piece of stomach or a piece of intestine can go through that and go into your chest.
Okay.
So these are diaphragmatic hernias. They're rare, but we see them. And then even more rare are the lumbar hernias. They happen in your back from previous back surgery or from previous trauma.
Okay.
Yeah.
So how can a patient know that they might have a hernia, doctor?
So typically there's a bulge where the hernia happens, and there's also associated pain with that area.
Mm-hmm.
Yeah. And then if you suspect you have a hernia, you need to see your doctor, and through a physical exam,
they can usually detect it.
They can usually detect it. If it's not obvious, sometimes we resort to doing an ultrasound or a CT scan to make sure of the diagnosis.
Okay.
Yeah.
Is it more common in males or females, the hernias, doctor?
So it depends on where the hernia is. If it's an umbilical hernia, it's more common in females. The groin hernias are more common in males. And the other types of hernia are about the same. The diaphragmatic, the incisional hernias, it's about the same between males and females.
Okay. So what are, let's say, the different treatment modes for hernias, doctor?
Yeah, so all hernias are treated surgically. There's no, magic capsule. There's no medicine to treat the hernia. There's no
you have to do it surgically.
There's no exercise to treat the hernia. A hernia is a hole, and it needs to be fixed. So we fixed it by surgery. It can be fixed through an open surgery, basically a large incision, depending on how big the hernia is, or we do it laparoscopically nowadays. And I'm a laparoscopic surgeon, so I do most of my hernias laparoscopically, which means we make small, half-centimeter incisions to 1 centimeter incisions. We put it in a special camera, and we inflate your stomach with, CO2 gas. It gives us space to work in with the small holes we make. We put in our instruments, and we fix the hernia by suturing it, and then we place a piece of mesh. That's very important, to place a piece of mesh.
Why is that?
So the mesh, so the area in the hernia is weak tissue. So you want to make the tissue stronger by placing this piece of mesh there.
Okay, so it kind of makes it stronger for the years to go.
So the years to go. So you don't want the hernia to reoccur again.
Okay.
Yeah.
So it could reoccur again sometimes, doctor.
So if it's just fixed by suturing, there's a high chance of recurrence because
Okay.
the tissue itself is weak. So you want to make sure this tissue is strong. So what you do is you put a piece of mesh there, and that strengthens the tissue.
So what are some of the complications of hernias, doctor?
So what we worry about from the hernias is not like what a piece of fat going through a hole. Nothing's going to happen if fat goes through a hole. But what we worry about is like a piece of intestine goes through this hole. Let's say this is the intestine and this is the hole, and the intestine goes through this hole. Now, if it gets stuck there, it's called incarceration. That's bad, because if it gets stuck there for a long time, you can get obstruction from the intestine. You can get intestinal obstruction, and over a long time, you can get a cut off the blood supply to the intestine. We call that strangulation. and if the blood supply to any organ gets cut off, it will die off, and then you'll have basically stool swimming in your body. So you don't want to get it into that stage.
Okay.
Yeah.
Is there any foods that can cause hernias, Dr. Mohammad?
So not really. I did say constipation causes hernia. So if people eat like low fiber food, high fat foods without eating any fiber, and they get
bloated
and bloated, they can get a hernia.
Okay.
But there's no specific food which can cause hernia. Yeah.
Okay. What about sports? Sports can cause hernias, doctor, correct?
That's
Certain
right.
sports?
So that's right. So if you carry heavy objects suddenly, you can increase the pressure in the area.
Or like lifting weights all of a sudden?
Yeah,
too?
all of a sudden, without gradually increasing your, their strength, you can get a hernia where, a hernia in a weak spot. Especially if you're not with a trainer who can teach you probably how to carry weights. That's one. And then there's something called a sports hernia. This is not a real hernia. So we hear this a lot. So we see it in explosive athletes who run very quickly, like we're watching now the World Cup, Mbappe, Dembele, these very fast players, explosive players. They get some pain in the groin from tears in the muscle which attach to the groin. So it mimics a hernia because you have pain in the area, but if you examine them, there's no hole. If you do a CT scan and ultrasound, there's no hole. So it's actually a muscle injury.
Okay.
And how we diagnose it is we do an MRI, and it will show if there's a muscle injury or a tendinous injury. So how is this treated? How is a sports hernia treated? It's not a hernia, so it's rest and then medications to reduce inflammation with NSAIDs. And if it doesn't go in 2 months, then there's a surgery for that.
Okay, so have to be careful of that. A hernia is something genetic, Dr. Mohammad?
So it's not a genetic thing. It can be something you're born with, as I said before.
Okay.
Yeah.
So what advice now would you give the audience watching this evening for patients with hernias?
All right, so if you're medically fit to get your hernia fixed, I do advise getting your hernia fixed to avoid the complications we talked about the bowel and the incarceration and the obstruction, etc. And then you want to get your hernia fixed by a guy who is specialized in hernia repair. So you want to fix your hernia right in the first time. Recurrences, second times, third times, fourth times, the surgeries are much harder. So it's really best you get the hernia fixed properly the first time with a specialized surgeon.
Okay, well, very well said, Doctor. And it was a pleasure to have you on our program, Hala Kuwait. Thank you for coming,
Pleasure
sir.
was mine. Thank you.
Thank you. We'd like to thank our distinguished guest, Dr. Mohammad Alsulaimy. Dr. Mohammad is a senior specialist, laparoscopic and bariatric surgery on hernias. Thank you so much, doctor. And now we're going to move on to our next report, and it's the Did You Know segment. Stay tuned.